not all of the patients have been transferred, but you've made inroads in making sure that 91% at least is transferred to adequate facilities. We just wanted to know about the challenges of court processes brought forward by families and other families that are coming forward to say that they don't want the patients to be transferred. How long will the press ombudsman's recommendation in this regard be fully implemented, where the challenge is concerned? And do you have a certain time frame in terms of when all of them will actually, we can say that 100% of those patients have been transferred to adequate facilities?
Okay, thank you.
MEC Masa Kigana again from Eyewitness News. I just wanted to find out, in terms of the disciplinary process, where does your predecessor, the former MEC of Health, Dani Mahlangulai, are any of these charges leveled against her as well? We know that obviously she resigned moments before the report was released, but where is she now? Have you in any way contacted her? Do you have any relation with her?
Okay. Can I thank you once more for the questions. In terms of Y29, when you add up, there are two NGOs. I think it's Little Eden and Esidimeni, who are not cited in the Health Ombuds report. And we have highlighted the Health Ombuds. And Esidimeni is one of the NGOs that have taken legal route to stop us under the motivation that they were not mentioned. Yeah, our information is that Esidimeni was operating previously in one site, and the second site that was established by the NGO was established specifically for the Gauteng Marathon Mental Health Project. So we found patients there as we were tracking and accounting for patients who have left the life Esidimeni. Okay, so that accounts for that. Is that the main question? Have I answered you?
Yeah. Yeah.
Okay, thank you.
Just maybe, why were they not mentioned? Is there any reason as to why?
Yeah.
Or is it maybe?
Look, we did, but it's also something that we raised with the Health Ombuds, and I think the Health Ombuds will clarify even more because he went back to the processes. But our understanding is that they were not aware. So they were identified by the team of experts. You remember the 60 team of experts. Yeah. The issues of, I think one other matter that we are investigating as well, and should there be a need to take disciplinary measures, we will not hesitate, is those of the officials who were reporting to the Health Ombuds, if they had omitted to report these other two NGOs, and all we are following it up. But we're happy that we managed to also pull them in through our processes. The court processes, I have no doubt that if a matter is urgent, as it is in this case, the courts are able to give urgent interdicts. So that is the process that we will adopt in making sure that we de-risk the situation of patients that are still remaining in facilities. But what we've realized is that these patients are quite sensitive. Even if we have a court order, we must make sure that there are no conflicts in the process. The process is not conflictual around the patients. You can't go in there with whole hordes of police, and some of the patients easily have also convulsions and all that. So but in the meantime, as I've indicated, there are teams of health professionals that are making sure that their health is taken care of. My responsibility is directly to the Department of Health. And my focus has been on the Department of Health, making sure that we do everything possible to account for all the deaths, working with other agencies. Secondly, to ensure that we mitigate against further risk to the surviving patients, which we've reported to you on. Working with the Premier and the Minister of Health officers to ensure that the disciplinary measures that have to be taken by government are taken, and also to account to the public, because this is a public interest issue. So unfortunately, in my place, in this capacity as MEC for Health, I am not able to account for what the MEC, the previous MEC is doing. I actually do not know what she is doing, and I have been focusing on making sure that the department responds adequately to the recommendations. Thank you.
Thank you very much, MEC.
Sorry, just to answer my question about in the disciplinary process, is she implicated at all? Is she one of the senior officials?
You are not able to. The disciplinary processes are for employees of the department in accordance with the Public Service Administration Act and policies. So she is not an employee. She was a public representative. And there was also another person who the report said disciplinary measures should be looked at, who was also not an employee of the department, the chair of the Mental Health Review Board. I must also report that her case, we've dealt with it in line with the Mental Health Care Act, which requires that an inquiry be instituted. We have suspended her activities in the Mental Health Review Board, and we have already begun the inquiry process.
And on the charges, are you at all at liberty to say what charges are being?
Yeah, can I ask that at this point in time we should not get into it, so that the process should be as fair as possible. Sometimes if you undermine the fairness of the process, you actually undermine justice itself. Thank you.
Thank you, Ms. Are there other questions, colleagues? We thought we should give you enough time. We know that we've been receiving a number of media inquiries during the week around this matter. If there are no further questions, let me thank you very much for coming through to this media briefing, and also say that we will allow for colleagues that would want to have one-on-ones with the MEC a bit of time just to interact after the press conference. But once we thank you very much, this brings us to the end of this briefing. Thank you.
Thank you very much. Enjoy the rest of Sunday. Thank you.
It's a Sunday afternoon church.
It's only one church.
It's only my church.
Okay.
Oh, yours.
Okay.
Colleagues, can you please sign the attendance register? Sorry about this. Thank you very much. Okay.
I was looking for your numbers in the morning.
Ah.
Yeah, because I didn't know that the press briefing was today. And then I got a WhatsApp from the assignments editor like, no, you have to rush to the
Oh.